When we're observing a knee in action, we also want to see the motion of the foot, the motion of the torso, and the hip. The reason is because the rate with which your body creates motion at your foot, the motion at your hip, directly shows you how forces are hitting the knee. If we're suddenly dropping in the arch of the foot or we're suddenly tipping the knee in, if there's sudden changes in your capacity to control that force at the hip or the foot, the knee is going to be where those forces start to accumulate in the lower limb. And that's one of the reasons why the knee is so commonly aggravated. And sometimes these don't show up as foot pain or hip pain, right? It shows up as knee pain, but the places where you are losing tension, losing control is ultimately where we need to focus our attention. Welcome to the Doc Wishloff Podcast. I am your host, Dr. Kirsten Wishloff, and we are going to talk about knee pain today. This is the start of the runway into my 4-day fix. This time around, we're doing in December for the first time. We are going through a 4-day fix for foot and knee. So if you are someone suffering from foot pain or knee pain, or if you are a clinician or personal trainer who works with clients suffering with knee pain and foot pain, get yourself registered. The 4-day fix is completely free. It's a live interactive program. We're going to be sorting out those knee and foot problems. We paired them together because they work together. That is why we paired those two pieces of your body together, and that's what we're going to go over in that workshop. Again, link in the show notes to put your name on the list to get into that free program in December. Without further ado, let's get into it. So we're going to talk about knee pain. We're going to do this in a couple of parts because it's a big topic, ultimately. Knee pain is very prevalent. It exists in a lot of people, and it comes in many different shapes and forms. And that's why it becomes one of those things that's tough to navigate because there's not really a clear-cut one answer is right for everyone. When we're talking about knees are the combination of movement of your femur and your tibia with patella and fibula on the sidelines kind of, supporting some of that movement. But that means, your hip bone's connected to your knee bone, right? That femur is occurring at your hip and it's happening at your knee, and that shin bone is also part of your ankle. And so because those two bones are connected at different joints, we have to look at that movement system. And not only are we looking at the ranges of motion, which commonly kind of people go down that little rabbit hole of how much range of motion do you have that'll solve all your problems, increase your hip internal rotation, whatever the case is. We want to start to look at the sequence of flow of movement. So it's not about the total range of motion. It's about the sequence your body uses to collect that motion. And that is absolutely the case when it comes to the knee. So today we're going to talk about issues that show up at the knee that are relating to instability. Now, when I say instability, I'm talking about ligament damage. So ACLs, MCLs, LCLs, all your CLs, collateral ligaments, and anything, even from a mechanical perspective, that's not showing up as a tear to a ligament, but any sort of instability. So let's go non-surgical cases first, just because it's going to be a little bit more of a can of worms when we're talking about surgical repairs. If we're talking about pain problems at the knee that is relating to perceived instability, and not to the point of surgical or actual structural damage, what we want to start to look at is the sequence through which your body is creating movement. So when we're observing a knee in action, we also want to see the motion of the foot, the motion of the torso, and the hip. The reason is because the rate with which your body creates motion at your foot and the rate at the motion at your hip directly shows you how forces are hitting the knee. If we're suddenly dropping in the arch of the foot or we're suddenly tipping the knee in, if there's sudden changes in your capacity to control that force at the hip or the foot, the knee is going to be where those forces start to accumulate in the lower limb. And that's one of the reasons why the knee is so commonly aggravated. And sometimes these don't show up as foot pain or hip pain, right? It shows up as knee pain, but the places where you are losing tension, losing control is ultimately where we need to focus our attention. One of the things I see a lot of the time is people misinterpreting a restricted range of motion as a problem of mobility. Let me go into a little bit more depth on that. When we are missing movement at a joint, when it comes to the knee, If we are missing the ability to flex our knee, it could be some sort of structural block, but it could also be fluid being retained there, right? We could have a lymphatic flushing issue and we're getting so much fluid in the knee capsule that it can't actually bend. If we're talking about extension and the inability to extend your knee, again, it could be structural, or it could be, again, that fluid, or it could be your muscles tightening up in order to create that stability. One of the biggest misses that I see in the rehab land is forcing movement into the knee or the ankle when a muscle feels tight. A muscle that is tight, that is blocking a range of motion, is doing so because it does not feel safe and stable. That is why a muscle is going to reactively tighten up. And this is different than if, you did a heavy bike workout and your quad tightens up. That's going to be a different mechanism than something as reactive guarding tension. So the first thing we want to do when we see a knee that is missing a range of motion is to create multiple alternative pathways of stability. Because if your body doesn't have a lot of different ways to stabilize, it's going to lock down that knee and hold a lot of tension in it. This is one of the biggest mistakes I see, because there is value in pushing into an end range of motion at your knee if that restriction is due to stiff fascial tissue. But if it is due to your muscles guarding instability, you are going to run into problems if you force your knee over your toe or you force your knee into a particular position. This is a really big misunderstanding in a lot of different systems. And this can be one of the reasons, again, why knees are so hard to navigate, because ultimately those two knee pains that are, restricted ranges of motion are happening for two completely opposing reasons. And this is why I generally default in all of the posture revival and runners revival, all of the revival programs, we start by adding stability, because no matter what is going on in your knee, if we start by creating coordinated stability in comfortable mid-ranges, it's going to show you if it was a problem of stability or a problem of mobility, right? If we start by adding mobility, you're going to find out the hard way that what it was actually asking for was more stability. So the first place we want to go to when we are experiencing pain or a restricted range of motion is adding stability, ensuring that fluid can flow out of the knee freely. And then we're plugging together these pieces of the puzzle, including hips and feet, so that the knee, as we start to rebuild that stability around it, is going forward in a sustainable pathway. We're not having these restrictions of motion at the hip or the foot that are going to continue to pour those forces in an imbalanced way into the knee. So that's really one of the first things that I see. We're going to talk about that definitely in the 4-day fix of how do we create these pathways of stability to show you if it was a restricted range of motion because of a lack of stability, or if it was restriction due to fascial tension, post-surgical, scar, etc. So we really want to make sure that we are strategically peeling down the layers of a knee problem instead of opening you up for worse injury. When we take that route of talking about instability, we certainly can jump into this idea of reconstructive surgery at the knee. I'm not today going to go through the depths of should you get ACL surgery, should you do hamstring, should you do patella. We're not going to go into that on this podcast. If you guys are interested in chatting about that, I'm happy to. Leave me a note. I'll open up that episode. But what I do want to talk about is that post-surgical window of time. Now, there's protocols to restoring range of motion in that post-surgical time, but we want to be cognizant of how we are spending that time, because most of those protocols are focused on the knee joint in isolation. What those post-surgical protocols often miss are restoring pressure points in the foot, restoring motion at the foot and ankle as a part of regaining control of the knee. Yes, we can look at quad strength in isolation. Yes, we can look at flexion and extension at that knee joint. But if you can't take this new surgical joint and move your foot in coordination with it, you are going to run into problems down the line. Maybe not a year from now, maybe not 2 years from now, maybe 5 years, 10 years from now. It's going to start to show up in other areas of your body. And that's what I generally see as a practitioner who works with people with chronic injuries that don't have a clear starting point. I find these people who have had this surgery without proper recovery and restoration to the movement through the system, not just at the knee joint, but through the entirety of the system. And it starts to show up as back pain, or it starts to show up as shoulder pain. So what I'm really trying to get clear to you guys in my online programs and this podcast is that, yes, we can look at an injury in isolation, and especially post-surgically, there's value in seeing the flow of movement in an isolated manner, but we need to start integrating that flow of movement at the knee within the foot, within the hip, within the core, within the torso, because all of those movements are going to be impacted if you don't reorganize the coordination and stability. And so this is what I will leave you with for today's podcast, is this idea that stability actually is the way you open up more range of motion when it comes to problems of reactive guarding. So when we are thinking about restricted motion at the knee, if the muscles are trying to protect you, they are going to restrict range of motion. And ultimately, it is doing that as a favor to you so you do not get hurt further at the knee. The first place we want to look to is the ankle and the hip when we are trying to reorganize that stability at the knee. We can introduce exercises to show you if that reactive tension is what's blocking movement at your knee as a starting point. If at that point we have recoordinated motion and stability at the knee and that motion still hasn't opened up, then we start talking about forcing into bigger ranges of motion, holding stretches, or various, pushing the knee over the toe styles of exercises. But we have to be clear at the cause of the movement restriction before we force motion to happen. As a default, I will always tell you your body is probably doing that to help you out. So if you are viewing your knee pain as a mobility problem and you're trying to force motion at your hip or force motion at your ankle, you are probably fighting what your body is instinctually asking for by doing that. So there is a strategy that we can use to start to layer in interventions so it starts to become a really effective way to restore movement and relieve pain at your knee. Instead of just forcing motion you think you should have, we can start to create motion that you can control. That's really the difference that we want to see. So we'll call this episode part 1. We're talking about instability at the knee in this episode and why you might be inclined to add stability versus forcing mobility into the knee as a starting point for any knee that is missing movement. We want to make sure that we are picking the right intervention, and that is what we want to start with always at the knee because it's going to show you what the next intervention should be. In part 2, we are going to talk further about inflammation and tendon problems in the knee. So if you are interested in this knee stuff, make sure that you are in there getting registered for the 4-day fix. And if you are someone who is dealing with tendon pain in your knee or problems of arthritis, we're going to talk about that on the next episode. Thank you for tuning in. I love talking all things knee. I love solving a knee problem, and I'm looking forward to chatting with you guys this month about knees. Once again.